Hey friend, hey. Let me make sure I got this. Can y'all hear me? Am I live? Can you hear me? T.S. Madison. I don't know if y'all know who T.S. Madison is, but when she starts, she normally say, "Is we live?" And she say a word that I'm not gonna say. And she be like, "Can you hear me?" So baby, are we live? Can you hear me? Anywho, hey friend, hey, happy 2024. This is our year to shine. My word for this year is confidence. Baby, it's not my only word, but that's one of my words for this year is confidence. Okay. Anyway, hey friend, hey, welcome back. If you are new to my channel and this is your first time seeing me, baby, my name is Lindsay. I am a pharmacy technician. I have been a tech for 16 years. Okay. I started my career in Kroger Pharmacy a long time ago. And then in 2014, I opened up a pharmacy technician school. I have helped thousands of people become certified, okay? Become certified pharmacy technicians. So if that's something you're looking for, baby, go ahead and subscribe and ring the bell for notifications. I am going to teach you and motivate you all at the same time because that is what I do. So, welcome to the channel if you are new. And if you are a friend that has already been around, baby, welcome back. Okay. Welcome back to 2024, to my channel in 2024. And I am so excited about the information we're going to talk about today. I am going to go ahead and bring this PowerPoint to the stage, honey. Make sure you follow me on TikTok because last night I went live on TikTok and I was dropping gems. So if that is something that you're interested in learning more about how to pass your board exam, and then if you want to know how you can become a pharmacy technician in the hospital, remote jobs, so on and so forth, baby, holler at your girl because I'm on TikTok. Okay. Happy New Year. Like I said, it is 2024, baby. We made it. We made it. Okay. Some people didn't make it. Baby, Marvin Sapp said never would have made it. All right. But you did, and I'm glad you did. Hey, friend, hey, happy 2024. What are you doing in the new year? Drop it in the comments. I want to know, what are you doing in the new year? Baby, look at Tip. Why is he not talking? I don't know what's going on, but he's not talking. But anyway, my question here is, what are you using to memorize the top 200 drugs? How are you memorizing your top 200 drugs? How are you doing it, friend? I want to know. I want to know, how are you using the material you have? Is it working? Okay. I have a free top 200 drug e-card book that I've been talking about that is really good for memorizing information, especially the top 200 drugs. And the video description, nope, the ebook description or the link is in the video description. That's what I'm trying to say, child. The link to the ebook is in my video description of this video. So if you need to get it, go ahead and click it. It is free for you to download, so you don't have to worry about that. It is totally free. And it has helped so many people, so make sure you get that, okay? Let's go ahead and jump in. So we're talking about the TJC. First of all, this video is going to be all about hospital pharmacy technician things and how pharm techs work in the hospital. When you become certified, you are going to want to get out there retail, okay? I have told people before, baby, retail jobs is good for your first year, maybe your first 3 years in pharmacy. But once you become certified, my lips dry. Once you become certified, you want to come up out there retail pharmacy after 3 years. Okay. You don't be trying to make no career out of Walgreens and CVS. Okay. Unless you are working your way up. Because I don't know if y'all know this or not, but CVS, well, I'll talk about Walgreens. I know for a fact Walgreens store managers are pharmacy technicians. It is a requirement for Walgreens store managers to have their pharmacy technician license. So if you are in retail math, baby, I mean, not retail math, if you are in retail pharmacy, baby, let it be in some type of leadership role. Now, I know people who have been in retail pharmacy for 20 some years and they like it. And if that's you, baby, that's your business. Like Tabitha Brown said, baby, that's your business if that's what you want to do. But for my friends who are looking to become certified and then possibly move forward to become a hospital tech, this is a great video for you. The Texas Joint Commission, it says TJC does not inspect or accreditate what? So if you're not familiar with TJC, the Texas Joint Commission is the organization. They're also known as JCO, and they are the organization that comes into the pharmacy, and they do a lot of accrediting, and they don't necessarily come into retail pharmacies, but when you're in the hospital, you will see them. Okay, let me make sure. You will see them once you're in the hospital. I was trying to see if I could pull something up, but anywho, yeah. So anyway, so when you think about the Texas Joint Commission, I want you to think about everything except for retail pharmacy, because they do not, I repeat, they do not accreditate or do any type of inspection in the retail pharmacy. It is all hospital, okay? It is all hospital in long-term care facilities and things like that. Okay. And remember, long-term care facilities is kind of like anywhere where someone can live overnight. They can not live, but spend the night. And you can't spend the night in a retail pharmacy. Okay. So it's wherever they can actually kind of stay over. The next one talks about hospital orders. Hospital orders contain which information? Now, remember, this is going to be for my friends who are going to the hospital and you're trying to see what is going to be on this hospital order. When you think about the hospital order, you're thinking about drug to drug interactions. You're thinking about dietary restrictions, right? So I am lactose intolerant. Look, baby, I used to eat up some cheese and some milk when I was young. But at my big age, at my real cute age, if I tried to eat it, girl, it would tear my stomach up. And so that's a dietary restriction. Somebody may be allergic to peanuts. That's a dietary restriction, okay? And then you have medication orders. And medication order simply just says what the doctor is ordering, and it's on a medication order that is sent to the patient's room. And when it goes to the patient's room, it's there so those patients, so the doctors and the nurse can, take care of the patient and administer the medication correctly. Because, and really just the nurse, because the doctor is not administering any medication. But the pharmacy, we're filling those orders and we're sending it, the medication, to the nurse. Okay, the nurse is picking it up, and then the doctors is writing the orders, the pharm techs are filling it, and then the nurse is administering the medication or giving it to the patient. And it says hospital order contain which information? That would be D, all of the above. All of the above, okay? D, all of the above. Hospital terminology. What is the meaning of the acronym CPOE? CPOE. This one is really easy, especially if you're looking at the image down below, because in the image, it tells you that CPOE stands for computerized physician order, okay? Physician can also be prescriber. That's another word for it, okay? This is a good acronym that you may see in the hospital, so you do want to know this terminology. Now, I put her here, and baby, she ain't talking, but I don't know what happened with that. But basically, this is to let you know that it's time to get started, friend. It is time to get started. Like I said, I don't know if you were following me on TikTok, but I did something the other day when I talked about getting started. Getting started is where it actually matters. Okay. Some of us are waiting on the perfect time. Some of us are waiting on a certain amount of money to be in the bank. Some of us are waiting on people, other people, to help us. Some of us are not trusting ourselves. We're just not. And we're waiting on somebody to come save us. And I got news for you, sweetie. No one is coming to save you but you. So you need to put on your big girl panties and you need to get started. Whatever that started thing is. So it could be um, studying to take your board exam to pass your test. It could be opening up a new business. It could be cleaning your room. It could be walking the dog. It could be anything as simple as cooking for yourself every day and not eating out. Whatever that get started thing is, do it, friend. This is your sign. This is your confirmation. This you've been praying, you've been asking the universe, you've been asking God, you've been asking your higher power. Send me a sign, and this is your sign. This is your sign that it is your time to do something you've never done before. So you can have something you've never had before, friend. Get started. Get started. And you don't have to get started by being rich. You know, I think people will be like, well, once I get well, then I'm gonna do this. Well, there's a journey to getting well. You don't just you don't just get it overnight if you lost it, right? You have to work towards it. Okay, friend. Trust in yourself, believe in yourself, okay, and get started. It's 2024. Some of y'all have been watching my channel and been with me talking about you're gonna pass your board exam, and it's 2 years later, baby, and you still ain't took it. And if you did take it, you ain't passed it. You got to do something new. Okay. Hospital work schedule. Hospital technicians must be available to do what? Now, one thing about the hospital, baby, it's 24/7. It's 24, it's 7-Eleven. Baby, it's wide open. It's every day, all day. It don't stop. It's Thanksgiving, but the hospital's still open. Baby, it's New Year's Eve, but them people is still in position. If you want to work at the hospital, because I got friends who be like, oh, they be making $35 an hour. They probably do because they gotta be there. If you want to work at the hospital, keep in mind that you need to be open like a 7-Eleven, baby. You need to be open to every eligible position and schedule that they have available if that's what you want to do. And it's what you signed up for. Period. Okay. Hospital technicians must be available to do what? Baby, all of the above. Fill in different jobs per operational needs, work weekends, work various shifts, work the holidays. When they say various shifts, because baby, if they put in work holidays, some people is gonna immediately walk away. But if they say various shifts, that covers everything. Baby, you need to be able to work every day, every time that they call you. If it's 7 to 7 in the morning to 7 in the evening, or 7 in the evening to 7 in the morning, whatever it is, you have to be available for that. When I worked at the hospital, I worked on the health plan side, and I worked from 9 to 5. Yeah, it was 9 to 5. And I was cool with that because who ain't trying to work on Christmas is me. Okay. And the weekends is my weekends, baby. That's my time and I want it. And so when you work at the hospital, you have to keep in mind that you need to be open because these people are, look, the sick people ain't going home. They at the hospital. As a technician, you also have the responsibilities of doing all of the above, which is printing labels for the IV medication. Because remember, as a pharmacy tech, we do make medication. We do make the IV bags. Preparing the antibiotics, and then also making sure that we are discontinuing the IV medications per the physician's order. That just basically means that if the doctor says, hey, room 1311 is not going to get antibiotics through IVs anymore, then we have to put those notes in the system to make sure that that room has been discontinued of the medication that they were receiving through the IV. The only thing we're not going to do is contact the doctor for order clarification. That is what the pharmacist does. And that's in the hospital and in the retail. You will never contact the doctor for a new prescription or for clarification on the order, because when you get clarification on the order, they are basically telling you what's on this piece of paper does not stick. Let me give you something new, right? And so, as technicians, we do not, it's out of our scope of practice to take new prescriptions over the phone from a doctor or to do anything that involves new prescriptions. So you definitely need to write that down. That's something you will be tested over. It will ask you, can a technician take new prescriptions? The answer is no. You cannot take a new prescription over the phone from a doctor, but you can take a new prescription from a patient who's walking in the door. Okay, but remember at the hospital, they're not walking in the door because they are inpatient. So that means that that patient is in the room and they can't get out the bed. Okay, so definitely make sure you write that down. Investigational drugs, true or false? Which statement about investigational drugs is false? It says an application must be filled with the FDA before the clinical study. That sounds about true. An investigational drug must be disposed of on site at the hospital where the study has taken place. A logbook containing all required information on the investigational drug must be maintained by the pharmacy. A clinical trial with investigational drugs in the last phase before a drug is the last phase before a drug is approved by the FDA. Which one? And the answer is D. I hope that you wrote that down and that you do remember this, okay? Because investigational drugs are very important, especially in they're very important, especially when you have a patient who's trying to get a cure to something. They're trying to figure out how to stop something, how to slow something down. They're looking for the right treatment. That's the word I want to use. They're looking for the right treatment. Okay. And investigational drugs are when they're just trying to find, hey, what's going to work for this person? What is going to work for this person? When you are, I want you to know, because so many of my friends are asking, how can I pass this board exam? How can I pass this board exam? And what I will tell you is to pass this test, you have to have confidence. You need the confidence to believe in yourself. You need the confidence to believe that what you learn will help you in passing this board exam. I always tell you that everything in your past has prepared you for this moment because I truly believe that. I truly believe that nothing is by coincidence. And I truly believe that everything that you've done has put you on track to be in the place that you're in right now. What you lack sometimes is confidence. Sometimes I lack confidence, especially when it's something new I've never done before. Because a lot of things that I tend to do are things that nobody in my family has done before. Nobody that I know has done it, right? And now that I'm in this space of owning a school, I am now meeting people who own schools too that look like me, right? And so prior to getting started, I didn't know anybody who owned a school, and I didn't know anybody who owned a school that looked like me. So it tells you this is where you're supposed to be, because once you get started, you are going to attract everything that you want to become. I said this last night on my live on TikTok. If you are waiting for the Gucci bags to happen, if you're waiting to drive the fancy car, if you're waiting to live in the 7-bedroom home, if you are waiting to have a pool in your backyard, if you're waiting to have the 6-figure job before you start living, you are limiting yourself to the freedom that comes with the space you're in. There is freedom in the space you're in right now. There is liberty where you are right now. There's power in the space you're in. And what we have to do as humans is we have to embody that power. We have to step in that space and say, this is mine and I own it. We need that confidence, friend. And I'm going to be holding you accountable this year, and you can hold me accountable too. Be confident in what you're doing. But before you are confident in anything else, you have to be confident in you. I told my son the other day, he's 16, and I said, you have to bet on yourself. You've got to take the opportunity to bet on you. If I got to bet on anything, if I have to trust anything, baby, I'm trusting me, because people will let you down. People will let you down. Okay. But you, on the other hand, know what it takes in order to get to the spot you want to be in. Don't allow 2024 to start and you don't do something new that you wasn't doing in 2023. Today is your moment, it's your opportunity. And the way that you instill confidence is by building that muscle, right? Everything is like in life is a muscle. Your faith is a muscle, your brain is a muscle, right? The way that you take care of your body, right? All of that is in when I go and I do Pilates, and it's so funny because in the environment of my exercise, I can remember every move that we're about to do. And I can remember every, how the position and how it works. But baby, when I get out that Pilates class and if I try to do it at home, it's like I can't remember exactly what I was doing in the class to show somebody else what we're doing. But when I'm in the class, my body just does it. They call that muscle memory. And that's what you want to get within yourself. So you have that confidence to do all things. Is you want that muscle memory. And the way you gain muscle memory is by doing a little bit every day. It doesn't have to be at the same time. It doesn't have to be for a long period of time, but you do have to do something new. Okay. I tell my friends all the time, when you're studying for this board exam, study at least 30 minutes at a time. I think anything over 30 minutes is too long, because while you are studying, you're going to think about new things. You've already had some new thoughts while you've been listening to me. So why would you sit and look at a book longer than 30 minutes knowing that your mind is going to drift? That's why people struggle so hard with meditation, because they're like, how do I meditate? I can't stop thinking. Well, you're not necessarily supposed to stop thinking, but you are supposed to help yourself focus on one thought, right? And what we're doing here is we're trying to get you to that place where you have the confidence to go and step in front of that board exam and take the victory that is already yours. And this is something I want you to think about. As you get ready to become certified technicians this year, I want you to think about, what am I going to do with this pharmacy tech certification now that I have it? What is my plan? One of the issues that I have with college, I think college is fine and I think it's okay if you are going for, some type of surgery to be a surgeon. Maybe you're going to be a pediatric surgeon. Maybe you're going to be, some sort of medical doctor. Maybe you're going to be a pharmacist. All of those things are great. But people go and they get these degrees, and sometimes they just get like a random degree. And when they get out of college, they don't know how to apply it because they didn't have really a plan, maybe. I don't know. But what I will tell you for skills and trades is, if you create your plan before you actually obtain what you're reaching for, you give yourself a pathway to walk. And some of us may not be passing our board exam because we're not motivated enough to pass it, because it's like, okay, well, once I pass it, what am I going to do? Figure out what you want to do now. This is why I'm exposing you to hospital pharmacy. Do you want to be a hospital pharmacy technician? Do you want to be a retail pharmacy tech? Do you want to be a mail order pharmacy tech? Do you want to be a nuclear pharmacy tech? Do you want to be a traveling tech where you travel here, there, everywhere, right? Do you want to be a remote work from home pharmacy technician? Do you want to be a pharmacy tech recruiter? Do you want to be a pharmacy tech instructor? These are all different roles that you can play as a pharmacy tech. Do you want to be a pharmacy tech supervisor? That's 9, right? Do you want to be a pharmacy technician that work at a prison? That's 10. I can tell you so many different ways you can apply your license and certification as a pharmacy technician. And if you're struggling with that, let me know. Like, what are the ways that we can become pharmacy techs? Let me know. I'll talk about that. I tend to talk about a lot more things on my TikTok about pharmacy tech and the roles that you all can have, because I like to use my YouTube channel for educational purposes so you can learn about how to pass this board exam, because obviously if you can't pass the board exam, then you can't have the other things that come after it. But there's so many different ways that you can utilize your license, friend. Don't limit yourself to just being in Walgreens or some sort of retail pharmacy. Before we even get to that, have confidence in you. Believe in what you can bring to the table, because there is nobody in this world like you. There is nobody in your family like you. And even if you are a twin, a quadruplet, a triplet, you are still unique in your own way. And right now, there is something in this world that is missing you. And it's going to take you to have confidence in you in order to seize that opportunity and get to where you need to be. Okay. Think about that. Don't let that slip from your mind. Nobody else is like you. When you work in a hospital, there is something called stat orders, and stat orders need to be filled within 15 minutes. This one says 10, 20, 25, 30, right? So we know that 15 is under the 20 and 10 is will fall in that range. So the answer here would be letter A, okay? Hospital pharmacy, all of this in hospital pharmacy, when they're calling code blue, they're talking to the pharmacy too, because there may be some medication that they need to get sent to the 15th floor, and we have to be in position for that. Hospital pharmacy pays a lot more because the risk is higher. The greater the risk, the higher the pay, right? And that's how that works in the medical field, right? Because pharmacists make more money than technicians, and that's because they have a greater responsibility on their shoulders than technicians do. So if you're thinking about hospital pharmacy as you become a certified technician, just know, to whom much is given, much is required. To whom much is given, much is required. Y'all have said, how can I follow you on TikTok? I'm at CPHT Lindsay, and I am going live on TikTok as often as I can to talk about jobs. I just posted a job not too long ago that was paying $80,000 to a pharmacy technician. Do you know the highest paid pharmacy technician in 2023 made $90,000 with a certificate? A certificate. $90,000 as a pharmacy tech. People with degrees are not even making that. This is your time, friend. This is your moment. This is the opportunity for you to seize, right? Don't let anything pass you by. Don't let anything pass you by. Okay. If you, hey Tamika girl, I just seen it because I had this thing on big. But this is your opportunity, friend. I told you, when you come to this channel, I am going to teach you and I'm going to motivate you at the same time. Because too often we as women, especially women of color, we don't get what we deserve because we're so busy pouring into everyone else that we get left behind. And in 2024, I am making a conscious decision to myself to pour into me more. So that means that there are some things that I'm pulling away from. There are some things that I am not giving because I'm working on receiving more. I told my friends on TikTok last night, one of my words for 2024 is receiving. I am working more on how to receive and not always give, because I think we as women, we're always in the position where we're giving because we are nurturers by nature, and that is just who we are. And we love to make sure that everybody else is taken care of, that we leave ourselves on the back burner. So, friend, in 2024, let's be intentional about taking our goals serious and making sure that we receive the good things that we've put into people and the good things we've put into the universe, because you reap what you sow. So if you've been giving good things out, you got to know good things are coming back, right? And so I'm just being intentional about that. And I want you to do the same thing. Take back your future. This is your year. This is your time. And if you are chiming into this message right here, this is your signal. This is your opportunity. This is the confirmation that you asked for, that when you become a certified technician, you can go on to do greater things. If somebody would have told me in 2007 that my 18-year-old self was going to be a business owner and live the lifestyle that I live right now, and that this space as a pharmacy technician was going to propel me to that, I would have never believed it. I would have never believed it. I would have never, ever, ever believed it. I was one of those people that I always knew I was going to be successful, but I didn't know how. I didn't know how. And I'll be honest with you, I grew up in a single parent home, and college wasn't really a conversation on the table. My mom worked multiple jobs to provide for me. And so I didn't know how I was going to be successful, but I knew it was going to happen. And that's why I'm telling you, friend, that this is a pathway that you can be great in. Don't let your moment pass you by. Continue to do everything you can, because everything in your past has prepared you for this moment. I'm showing you hospital math because I want you to know you have options. You have options. You don't have to just be in retail. You have so many different options. And so this is my way of saying Happy New Year to you. Let 2024 be a year of prosperity, be a year of creativity, be a year of strategies, witty ideas that allow you to reach your goals. I told my friends last night, I am not doing a vision board with pictures this year. This year, I'm doing a vision board that are going to be filled with strategies, because if this is my goal, I need to know how to reach it. And sometimes pictures are good because they help you manifest, but they don't always give you clear direction. And that's what I'm seeking in life, because I don't mind things taking time. I just don't want to waste time. You know how you walk through door A because you thought that door A was going to lead to door C? And sometimes door A may get you to door C, but it may take 10 years if you go through door A to get to C, other than if you would have went through door B, which would have took 1 year, right? Why we did that? Because we didn't have strategy. So I pray that you get strategy, you gain clarity throughout this new year, and that it leads you to the place that you want to be in life, because the destination is still there for you. It is still there for you, and it is still possible, friend. So happy new year. It is 2024. Let's love, let's live, and let's enjoy life to the fullest. And with that being said, I will be here next week. I am trying to make sure that Tuesdays are my day that I see you every week. If you want to see me at a certain time, please let me know. I am open. I am trying to make sure that my schedule fits with yours. But even if it don't, you can always watch the replay, because I make sure that they are up. Okay. I love you so much, friends. Have a great week. I will see you next Tuesday at the same place. Okay. If you have not subscribed to the channel, make sure you do so and give this video a thumbs up so it can get into the algorithm and we can help other people. Friend, I need your help so we can help other people. See you next week. Bye.